important is the food that we're eating in the first 2 to 4 or 5 years of life, and what does that set us up for down the road?
You know, Scott, it sets the stage for a whole host of either good health or poor health. I'm blessed because I have 5 children, ages 4 to 34. And, you know, as we develop with more science and knowledge, the 4-year-olds got the benefit of what I learned before the 34-year-old. But I have to say, the 34-year-old, I remember my wife was breastfeeding at the time, and the baby was getting colicky and having problems and having trouble sleeping. And I said, you know, I think it's the milk you're drinking that's somehow getting through the breast milk into the baby and affecting the baby. And she looked at me and says, that's strange, and didn't believe me. So I took her to Dr. Paul Fleiss. He's a renowned researcher, MD. He's a pediatrician from USC, UCLA. I mean, he's, you know, really well trained, and now I think he's approaching his 80s, you know. And he examined the baby, went through all the tests, my 34-year-old son, and now that was 34 years ago, and he said, he turned to her and he said, I think he's allergic to milk. You have to stop drinking milk, and maybe let's see what happens. Sure enough, she gave up the milk, the colic went away, the baby could sleep through the night. And that was my first introduction to prove that babies are so sensitive when they're so young, and their digestive tract is sensitive to leaky gut syndrome or certain proteins that are too complex for the human body. And even as we get older, oftentimes these proteins are too complex. My 4-year-old has the opportunity, because I started him off after 2 years of breastfeeding with his mom. We introduced coconut water, and then we gradually introduced bananas and some natural fruit and things. And so his doctor, Dr. Karchinell, says that he's got to be one of the most fortunate babies, because we have a perfect diet for him, you know, and the times he deviates, you know, he's at a little school function, eats something, you see the differences in his behavior, or you notice something comes up within, you know, his health and physiology and colds and flus and things. So oftentimes I think we've overlooked the importance for childhood nutrition and how that sets the stage for a future of either optimum health or poor health. But we can still adjust, even if, you know, our moms didn't know everything we know, and they didn't breastfeed, and they introduced some of these foods too soon. We can go back and kind of make the most basic type of diet to make it compatible, so that this person can have some relief, less inflammation, better health, better mental function and clarity, and overall prevent cardiovascular disease, reduce the incidence of diabetes, arthritis, heart disease. These things we now know about. Dr. Dean Ornish at this convention is talking about reversing atherosclerosis with the very same diet that I've been using for 35 years. Many of these are offshoots of Nathan Pritikin and his original research, which, by the way, he's been vindicated. Medicare recently approved his course lectures for the treatment of diabetes. We had an early study back in the 1980s of over 4,000 patients with diabetes, and to this day nothing's been matched to prove so well and conclusively that oils and fats is one of the principal factors that desensitizes insulin. Milk compounds the problem. But we realized that it wasn't just sugar alone that caused diabetes. There's far more to it.